today is to just kind of discuss and agree upon our OKRs, our objectives and key results. We've talked about them in a couple of meetings, sort of what our priorities look like based on the discussions that we've been having over 2025. And I basically put all our notes and minutes and recordings into Notebook LM, and it kind of set a list of priorities that I've shared out before, and I think those are actually on the wiki as well. And then kind of took those and put those into some OKRs. So I think what I'd like to do is kind of attack it the way Claire does. I'm just going to read them through and then ask for feedback and edit accordingly, and then we'll go from there. So things have been a little bit wonky. Most of you probably know with the Odyssey tenant and all of the Odyssey associated teams and emails. So that might be why we're missing some people today. It went down again on Thursday after being down for like a month. And so part of what this translates to for us is that we've got a little bit more time on the OKRs because they haven't been able to get to the point where the leads are presenting. So normally I probably would have tried to talk about this sooner, but because of those delays, we had a little bit of wiggle room. All right, so let me find, I know I pulled up on this page. Here we go. This is it. Yeah, this is our OKM. So I'm just going to read through these. So objective, establish best practices and standards for survey data modeling in the OPM CDM. So we want to have a formalization of the data representation standards to reduce ambiguity in how complex survey information should be represented in the OMOP Common Data Model. So the first one is classification framework document. So one of the things we've spent a lot of time talking about is sort of the different types of things that are surveys. So we've been trying to nail down a definition of this. So at the most, so basically publish a comprehensive guide that formalizes this classification for standard assessment instruments, and then distinguish between the psychometrically validated instruments and the standardized collection instruments. And we've talked about those definitions before, but we basically put this as part of our document. Data representation guidelines. Oh, wait, I should pause. So any comments or clarifications so far for the first objective and then the first results? I tend to just bulldoze through. Okay, so yeah, so I should say the bullets are basically the results we're getting. So we're going to classify those, then put together the data representation guidelines. So this is what we're wanting to share and get feedback on at the European Symposium. Develop a decision tree guidance for determining when to map survey data as facts, question answer pairs or triplets, and documentation and use cases and analytic implications for each approach. Any comments for that?
I like that. It's amazing how you got all that information in one sentence.
Yeah, I have to admit I'm sort of queen of the run-on.
No, but it wasn't though. I mean, it was exactly everything in one sentence, which I would never be able to do. So yeah, I like it.
I confess to having help from Claude. I use Claude to edit my stuff in Politics, so I can't take all the credit. Yeah, I do really like Claude. I have found that is the best one for writing type tasks. And some of our team actually like using it for coding too, but I haven't tried it for that.
Oh, good to know.
Yeah. But yeah, for writing, I actually did out of pocket the like paid tier because it's really cool. It'll tell you what it's doing in each step, and it actually gives you its code for doing that step. Which I think is kind of cool, because I think one of the things that has always troubled me a little bit about AI is what a black box process it is. So I kind of like that it does that. I feel like it's like showing its work.
Right.
All right, and the third one, metadata standards specification. So one of the things we've talked about repeatedly is wanting to store metadata that comes with a survey. So define and publish standardized conventions for capturing essential metadata, including data source provenance. So it should pop in here like the name of the survey. We also want to know, if it's patient self-report, is it informant reported? How's it administered? Both, again, patient reported or clinician. And we can also add things like paper, electronic interview, things like that. Any comments on that? I'm going to make myself a note about adding those other things.
Maybe evaluation interval as well.
Okay, I like that.
Nicole, I think that's great. But instead of patient, I would say a participant, because here we're not talking only about patients.
Right.
If you want to make it more generic.
Yeah, we could do that.
Or a person. Yeah.
Yeah, and maybe even person level, because patient tends to get used a lot in the literature for the stuff that's clinical, but it's not all clinical. Yeah,
exactly. So. This particular is broader than EHR. EHR data tends to be patient by definition, because it's from the health records. But surveys can definitely be people that don't go to the hospital necessarily. Mm-hmm. Yeah, maybe person, because participant involves that somebody implies that somebody actually participated, and sometimes it's not actually,
that's probably it's not always a cohort study. I think person makes it generic enough. It can apply to like cohort and clinical settings. And Diane, did I capture what you said about include the interval?
Yes.
Okay. Forget that you can't just hit enter with these. You have to hit the little arrow. Okay, great. Anything else before I move on to our next objective? Okay, so the next one is accelerate standardization of high unpacked survey vocabulary content. So we know we have critical vocabulary gaps, and this is one of the reasons a lot of the community has created their own custom concepts. And these tend to focus on social behavioral data and validated instruments, although I also think we can think of other examples. So I guess I should say, so what we've talked about with the vocabulary team or vocabulary work group is basically having a pipeline that allows us to add these new vocabularies. So I don't know if I should like specify this here, or we can go down and look at it at what the results or deliverables are. But before I start reading those, any comments about just the objective?
Hey, Nicole, it's Piper. Sorry, I was a few minutes late, so you might have already covered this. Are you on objective 2, or are we talking about the metadata standards?
We're on objective 2.
Okay.
But you're welcome to comment about the metadata standards if you have an additional thought.
If you scroll up, I was just looking at, so this classification framework, that's the paper that we're working on. I just wanted to sort of throw out to the group, because I know we have a couple of folks that are collaborating on that. There is a deadline in March if we wanted to submit it for the EMEA conference.
Okay.
Ideally, I'd like to get that paper out sooner rather than later. Do we think that's feasible?
I would say let's talk about that offline, since we're meeting later this afternoon, because I think for me, I have to kind of figure out how I can, there's a lot of overlap between that and what we're trying to, do for our proposal. So I guess just trying to figure out the timeline, because I'm feeling behind already.
Okay. Yep. So for now, let's just focus on the objectives and for the group. Okay.
Sounds good.
Yep.
All right. And then Monse?
Okay. Yeah, actually, that might be also for the objective 1 rather than 2, but it's part of the objectives to provide guidance, like, for instance, on the structure of the data, for instance, the nesting structure versus, because you can nest the repeated questions, or like pregnancies, things that are being repeated events, because the OMOP will have both, will determine standards for both the how the data is structured, right, into nested tables or whatever. So in addition to the vocabulary itself, is that correct? And where to include that? Because that is the one that we are struggling quite a bit. So what is the best way to nest? And everybody does it in a different way. So having some agree way of doing it might make it easier.
Monsi, are you thinking about nesting, so representing the nesting within a single survey, or are you thinking more broadly about how would we represent it when we know that we have common questions across multiple assessments or surveys?
That's a good point. I was thinking the first, but I think the second is also relevant. So I don't know whether that needs to be. If you do the, because it has to be across surveys, but within survey. But if we do it within a survey, wouldn't then also help across? If all the surveys is the same, then it will make it easier.
And this is something that we've talked about before. Like, how do we capture that? You know, we use a nested structure in Connect, which we capture in our JSON, but not sure how that translates. I know they use a nested structure in all of us. I think this kind of fits in the data representation guidelines, but I'm open to discussion if you think it should go someplace.
I think that's a good place. Yeah. Because it's not, I think that would be. Okay.
I think I saw some others unmute. Was there any other comments on that? I added a blurb for what we need to include. Okay, so make sure I hit the little arrow so it goes in there. Okay. So, priority vocabulary additions. Complete standardized vocabulary development for at least 3 high-impact contact areas identified through community assessment, including social and behavioral data domains, commonly used validated instruments. The 3 high impact was a random choice. I don't know that we necessarily want to specify how many we want to try to do. I actually think this results probably needs a little bit of work, but yeah, I'll open it up.
You say at least, so
yeah.
I think it's okay to have a minimum, because maybe only one, it will not be enough, because we will learn through, right? We're doing more than one makes sense. 3 doesn't seem too much, so looks fine.
Part of the 3 comes from the different ways you can map the facts, answer pairs, or triplets. And I think
have 3, exactly, that have different, that would bring up these different things, as you're saying.
Like 3 different use cases that cover
exactly that capture different representation or vocabulary things.
So Nicole, do you think, and Monsi, do you think for this one we would say in each of the assessment types, right? Because as you go up, our objective 1, in objective 1, the first bullet point is to sort of distinguish between the major classes of surveys or assessments. So maybe we want to say, do we want to do 3 instead of domain, maybe by 3 of each assessment type or assessment class, right? Survey, psychometric, whatever the classes are that we come up with.
Yeah, I think that makes sense.
Okay.
Oh, and I was thinking, just somehow talking about the classes reminded me of this. Piper, do you think we should have anything in the data representation guidelines also about recording scores? Or do you think that's, I mean, even if it's pretty well handled, I think we might want to say something about it.
So data representation guidelines, let me see, I think I wasn't here when you develop a decision tree for time. And when to map survey data as facts versus question answer pairs. So, yep, that's a good point, because this idea of what you're calling facts are the actual finding, right? So
Yeah.
you're going from an item, right, which is a question answer or a score, to the thing that represents.
Right. And one of the reasons I keep using the term fact is because that's how Christian defines it. So that's
Okay.
why I keep calling it fact, but then I included the examples.
Okay.
But yeah, what you've said is the definition of a fact is correct. So that's why I'm wondering if
Okay.
we should also add scores to this, because I know
Yeah.
the
Yep.
psychometrics. Yeah.
Yep. Yep. Absolutely. So I would say, I'm trying to think of what a general term is that we could use for, I would say component, right?
Okay.
Develop a decision guide for term when to map survey data. Well, now if you're saying survey, right, you're already talking about a specific class, but question
Yeah.
answers are both.
I feel like once we've defined this, the standardized assessment instrument, AKA survey, I mean survey at like the highest generic level. It's just
Yeah.
the vocabulary that we've been using.
Yeah. You know what, I've been using in my database when I'm setting this up, I've just been using the term instrument
Yeah.
as sort of a generic term. It could be but SAI is also a term I've been using. So yeah. Okay, so what you're saying is to develop guidance for determining when to map instrument components to facts, or when to represent instrument components as facts, as well as versus just the component itself, right? Because, all right, so that makes sense. And when you say facts, we're really talking about when we're going to have a clinical observation in one of the OMOP tables.
Yeah.
Yeah. Yeah. So I don't know, would it make sense, instead of saying map, for determining when to represent instrument components as facts, as well as, and I don't know if it would be versus, right? Because we're gonna represent the component, but in addition to the component. Okay, decision when to map instrument components. No, when to represent instrument components as facts.
Yeah. So, I mean, we can definitely like do the wordsmithing. I'm just asking you if you think there's a way to describe the score and how we want to add that to, do we want that as part of the representation guidelines?
So that's what, so I think if we use the term components encompass both the question and answer pairs, as well as scores, right? As well as potentially, yeah. And the scores aren't just the numeric scores, right? Sometimes the scores are qualitative things, like with the Columbia suicide risk, it's a risk level. So the high risk level result would then represent, do we add this clinical observation of high risk for suicide?
Yeah. But scores would be translated anyway, right? So in the case of the suicide thing, it's like a built-in translation. But so you would record the score and then what it means, and what it means would be your fact, correct?
Well, sometimes there's not always, and I see Craig's hand raised, so sometimes there's not always a score. Sometimes a score, you generate a score, and then you translate that. There's an interpretation, right, of risk, for example, risk, but sometimes it's not. Sometimes it's things like there are threshold. If you hit a threshold score on a certain number of items within the subscale, then it generates simply a qualitative thing. So And I'm seeing that a lot now that I'm going through all of the assessments we have in our EHR. Right, so you look at some of the child behavior assessments. There are subscale scores, but then there's also, does the child have a score of 4 or 5 on these items? And so anyways, so you'll get a qualitative metric or result without an actual numeric score. So they don't always go hand in hand.
Okay, so I just noted scores are qualitative equivalents. There might be a better way to phrase, but I feel like that covers both of what you're talking about.
So okay, so what I finally changed it to in my database is metrics.
Okay.
So a metric can be qualitative or quantitative. So I would say so essentially what we have is really 2 classes of things that could yield additional facts. So I would say those are your question answer pairs or your metrics. Those are the 2 components that would yield facts.
Okay. All right, Craig, what did you want to say?
Yeah, so I had a question about most of this conversation, which I thought was interesting. So we're talking about mapping components to facts. Is that something that I guess would be automated based on the result, or is this something that a clinician of some sort would put into, in this case, EHR system or in some way? Because when we're talking about mapping components to facts, I feel like that could also be something that would have been done with like measurement values, right? If you pause a test, mapping it to a condition. And that's not that I know of done in the CDM. So go ahead.
Oh, yeah, no, I'm sorry. So mapping to a fact is really similar to how the clinical data is mapped. So there is a condition code that says, lung disease, and maybe it's more specific, it says asthma. And so that's the fact that you've mapped to within the CDM. Doing that with a survey would be something like from our baseline and overall health instrument. It basically, it's like, has your healthcare provider told you have any of the following?
Right.
And one of the things that's listed is asthma. Well, if all I want to know is if the patient has self-reported asthma, or the participant or person has self-reported asthma, then that's the only thing I'm going to map, is that map to the condition of asthma. And I'm not necessarily maintaining the question answer pair. I'm just maintaining the fact that the participant has reported asthma.
Right. So what you're saying, trying to think of how to word this. Yeah, because you're mapping the component from the question answer pair to the condition, to the asthma part.
Right.
What I'm saying is in previous parts of CM, like you said, in the measurement, if you see like a positive lab test for COVID and you're mapping that to a COVID diagnosis, this would be equivalent to keeping the lab test and the positive lab test and then the condition component. And it's essentially the same thing here, just with a question and answer pair and then a clinical fact from that, correct?
Correct.
Okay. That makes sense. That's not, but the only way to link that, if I remember correctly, is via some sort of either visit ID or something of that effect. That would be both.
It depends on where. So for something like the lab test, it might be linked to a visit. I think for something like a questionnaire, it would be, so we talk about Liz, so it would be linked to the participant. It's not necessarily visit dependent, although like we used to associate our COVID questions with lab work because we're testing for the antibodies. But it could also, I guess I don't think I'm really answering your question, but I think what we would, what we save is there's, in the table that you create as you go through this process, you maintain your source codes. So my source code would be like whatever, like my personal concept IDs are for the question and answer pair. So I would have that relationship and I'd link it to the person table. You could possibly use like the date that it was completed as opposed to a visit date. To maintain that information. Yeah.
Yeah, I think my big point is that I would as a data scientist, I would want to make sure that link is maintained between the fact and the component. And I don't know if that doesn't seem to be something that's been done in the past. And I just wanted to make sure, because we've kind of been talking about it with the triplets and the different ways we're mapping, but that as from a user of the data, I would want to make sure that's maintained. And I didn't know if that was just what, through this whole conversation, if that was the idea.
Yeah, and it may be, so it would be maintained in the sense of your source codes. So what you had and before you translate it to the OMOP. So that would be maintained that way. I think we might also find as we, pull in our specific use cases in this documentation, that maybe there are no instances where we only want facts. Like we're always going to want to have a question and answer pair or a triplet. So we may not find that we want to do that. I think, but that also goes back to what kind of analytics you're wanting to do, because the easiest mapping is a fact, but it doesn't necessarily carry with it all the information you might want to retain about that instrument.
Right. And I do, and this is maybe a little bit of my naivety with some of the survey data, is because the fact I'm assuming would be based on, and when we're talking about score, you're talking about multiple question and answer pairs to get to a fact?
For scores, yeah.
Yeah. So I guess that's just a different way of that the data, when I think about how it's depicted, because you have the question answers that lead to a score, which lead to a fact.
Yeah. So Craig, you know what? This is a really important point you're bringing up. We've had this discussion that question answer pairs are really important for survey type instruments. Question answer pairs and the meaning of each question are less important for psychometric instruments which yield a score, because the score is the thing that is important. And as you're talking, so I wonder if there's two different approaches, and the approach is going to depend on the type of instrument. So I wonder, Nicole, for this data representation guidelines, I wonder if maybe we do just leave that survey data, because this is something that's relevant to survey data and I don't think is as relevant to psychometric instruments. And Craig, the other thing you bring up that I think is really important is when it comes to psychometrically validated assessments, they're essentially like lab tests, right? And we don't typically go through all of our lab results and then add a additional fact that says tested positive for COVID, right? Or anemic, right? We don't typically do that. Our analytics aren't typically based on facts. Our analytics in those cases are typically based on the empiric results, right? The scores or the lab result.
Yep.
So are you thinking maybe we need to have a second? So this is information we can keep with surveys. Some of the things here we're talking about nesting within between surveys, repeated measures, so on, would stay connected to survey. And then we would have like a separate sentence or paragraph to describe what representation guidelines would be needed for the psychometric instruments.
So I think there are definitely different data representation guidelines for different types of assessments. And Nicole, we talked about before at a very high level, the two major classes are surveys, right? versus psychometrically validated. Those are two major classes, and I think that those are different enough kinds of things that they have very different representation guidelines. So I would say your bullet point to go back to your original question is, I think this is specific to survey data. And I would say the issue of whether we need facts for scores is a different question. And I would say lower priority, because the facts are really important for the questions and answers for survey data. It's the facts that matter, right? It's not so much how you phrase your question. And for psychometrically validated assessments, it's the scores that matter, and they're a lot like lab tests. So you really can get those from the scores.
Yeah, so, but I do think we want to include a sentence or two about that in the data representation guidelines, because we want to produce both. Like, we don't want these guidelines to only be focused on surveys. So I think that's a good point. You know, we can't necessarily write one sentence that covers everything we have to do for both of these.
Yep.
So I think it just needs to be expanded to include that. And if we don't know what to call it yet, we don't know what to call it yet. And we, just say that needs to be, that's part of what needs to be developed as
And
the
I would say
representation.
Yeah, sorry to keep over talking you. I would say that I think that surveys and psychometrically validated assessments are different enough that we would not have a single guide for both of them. I would envision us having a separate guide, one guide for survey data and one guide for psychometrically validated instruments.
Yeah, and I don't think, they're separate guides in the sense that this is the section on how you do surveys and this is the section on how you do psychometrics. But I think we're talking about creating one, comprehensive document that is, standards for handling, instruments. And then it's okay to have this bifurcation of the different types within that document.
Yeah, I don't think you need a whole new bullet point. I think just differentiating them within the guideline would make it a lot easier than trying to come up with universal language for both of them. But I do think it would be better off in one guideline, just because I think they fit close enough together in that way.
Yeah, Muncie?
I agree with this, and it's an important discussion, but I realize I don't fully understand, and forgive my ignorance, how you define triplets, because I thought triplets were defining facts, not question and answer pairs. But the way you have here, you said facts versus question answer pairs or triplets. So can you?
Yeah, so triplets is basically keeping all three. Your question answer pair,
and the fact.
You're basically mapping those and the fact that they represent. So it's maintaining all three within the model.
Okay. The triplet. Okay. So the triplet is the question, the answer, and the interpretation of the fact.
Question, answer, and interpretation.
Okay. Yeah.
And the interpretation is the fact. How you define as a fact, which is more the concept. Is that?
Yeah, the interpretation, or so again, if I go back to has a medical professional ever told you have any of the following? So the question would be, has a medical professional ever told you? The following would be whatever you answer to that. So I'm going to say asthma. And then the factor interpretation would be that the person has a diagnosis of asthma, which would be in the condition table.
Okay, which is basically what you call, fact.
So that would be a triplet.
Question, answer, and fact. Yeah, okay. Okay, thank you.
But thanks for all this discussion is really helpful. So I appreciate it. Okay, so I think we'll head back down to the vocabulary section. Have you decided we'll rework this a little bit to include that bifurcation between the surveys and the psychometric instruments? Okay, so we're talking about, vocabulary addition. So basically trying to go through and develop some high impact contact areas through community assessment and what we're commonly using. And then I think, did I add a comment to that or no? Oh, no, I must have just highlighted it. Okay. Do we have comment? I don't remember what it said. Includes each of the major instrument classes. All right, we have that. And then one of the things we've also talked is about a way to promote the custom concepts. So we need to have, this is the pipeline part, a formal workflow for reviewing and promoting successfully mapped custom concepts, so that we stop doing this silo thing. And if we're lacking vocabulary, we can get that vocabulary included. So this is something that we document it, but it would be adapted by the vocabulary group. It would need to include some things like the submission templates, and also sort of governance or evaluation criteria. So, because we don't want to, have 3 iterations of almost the same thing go through and all get separate concepts. So there's going to have to be some evaluation of what's going through. And then I set this up as separate, but maybe it should be part of the same thing. We're also looking to collaborate more with Loink and SNOMED. So with the idea of first asking them if this is what they can add to their survey or survey equivalent vocabularies. And then if not, it would be the concept would then be created through the OMOP vocabulary group. So these two kind of go together. And then open for question comments.
So Nicole, are we envisioning, so you're saying the community, individual groups will create custom concepts and then submit them so that we would create these concepts in the OMOP extension, or would we have them just request them? You know what I'm saying?
I think that's a good question. I guess what I pictured in my head that we would start with are these custom concepts that already have been created. So UK Biobank, all of us, things like that, and then see if they'd be willing to put their concepts through this process. And we basically have the workflow. I think part of the workflow would be for what's not existent. Is this something that SNOMED or Loink is working on or would be willing to add? And then if the answer is no, or it doesn't fit into their schema, then it would move on to a approval process from the vocabulary group. So I think it would make sense to start with ones that are already in existence. But you ask a good question about would be the expectation as you create these and then go through the process. I think it would just be, I'm thinking out loud here, if people are mapping and they're not finding the concepts, then they would go to take a look at this pipeline. We probably want to have some sort of record of what's in the process, the pipeline, determine if anything in the pipeline is going to satisfy this, and then if not, set up their own request.
Okay, so I see again sort of two types of content, right? So the sort of psychometrically validated assessments, only those would ever be appropriate for Loink or SNOMED, right? So Loink or SNOMED would not add study-specific surveys unless, or I guess I don't know. I think Loink may, SNOMED for sure would not. Mm-hmm. So you're talking about, so I can see two things. I can see, like, as I'm looking at all of our flow sheet data, I'm seeing a lot of data for assessments and surveys that are like widely used, right? So those would always be appropriate within scope for both Loink and SNOMED. Mm-hmm. But then there's the other thing, like, do you remember at the meeting last year where we had the woman from Brazil talking about a big national survey that they have, and it's, I think, equivalent to the kinds of national surveys that CMS publishes, right? Mm-hmm. So those are, Loink does include CMS standard surveys. I don't know if LOINC would include standard surveys from other countries. So you're saying that might be one that would potentially, like, the folks in Brazil would maybe create this locally and have custom concepts, right, for the questions and answers. And then you're saying the pipeline would be, okay, so at what point do they then come to OMOP and say, hey, OMOP, we'd like you to create this national Brazilian health survey in the OMOP extension, right?
Yeah, but
And then you're saying but you're saying, do we have a way of maintaining this list of surveys that our people are using or building, and so that if 3 different sites have the same survey, they're not all creating custom concepts and they're not all working with OMOP?
Yeah, that's what I mean. We probably have to have some list of what is getting currently processed. And like you said, there's some things that I think Lincoln SNOMED would be open to or open to differently, but that would be and there could be criteria for submitting to those. And if you don't meet that criteria or you submit and neither of them think it's appropriate for their schema, then it would go on to being reviewed specifically by the vocabulary group for something that's specific to OMOP.
So Monsi, I see you have your hand raised, but I just want to reply really quick to Nicole before I forget that. So maybe, what do you think of this group, whatever this pipeline is, what if we do that legwork for folks, right? If folks are talking about the surveys or the assessment instruments they're using, and then this group can sort of work with them to determine, right, whether, because we know, is this within scope for SNOMED versus LOINC?
Yeah, we'll have to figure out how much we want to take up. I know I don't have the bandwidth for that.
Yeah.
We'd have to see if anybody did. But I think, what I think would be helpful would be having somebody who's already done this. Like, we definitely have members of this group from all of us, and ask all of us to like do this process so they can get their potentially get their like hopefully in a way that's mutually beneficial. And again, like UK Biobank might be a good example of it. But I mean, I think we can handle this the way I've seen the Common Data Model Group and Vocabulary Group handle it. You can come to their group, on one of our meetings, make a presentation, and we can tell you what you need to do next. But I don't think we could have people submit to us, evaluate those cases, and then decide to move them forward. But we could have them, present what they want to do and give them guidance.
Yeah.
All right, Monsi?
Yeah, I just want to comment on this. When I just thought about that when you said, okay, would that be like this survey for Brazil that will be added as a survey in OMOP or something. So I think as opposed to standardized assessments, which they tend to be, a unit that it's standardized by itself and it's scored, it has to be like this way. Surveys are a lot more flexible. I think there's not going to be almost never 2 surveys that are the same. So I don't think it will make sense to have vocabularies for surveys, but what it makes sense is to have it for domains or
Right.
like the smoking modules, I guess, a smoking module, because usually surveys, they just put different things to get modules together. So maybe rather than survey vocabularies, maybe we can talk about survey module, and never like have one that's, we don't want to have the connect survey.
Right.
We want to have the modules. And then if I want to do my survey, I will just mix them. So is that the idea? Because I think that would be much more practical for in an epidemiological setting.
It does, and defining it that way helps, because in my head, I wasn't thinking, I'm whole scale mapping it by survey. I'm just like submitting vocabulary from my survey that I couldn't map. But if we want to take a more holistic approach to it, which sounds like a good idea, doing it by content areas, and that might be another thing we want to think about for guidance, like how we move through the pipeline. Maybe it's, we're going to submit smoking vocabulary in the
Exactly.
next 3 months, submit your questions that are in this content area that you've
Yes.
not been able to map, and then go through that process.
Yeah.
And I saw a thumbs up from Diane, so I think
Yeah.
that's a good idea too.
It's also easier to prioritize because there are
Yeah.
content areas that are always asked, like smoking, your whatever. I mean, they already have like family history, right? I think that already sort of exists as a standard. Is it? I don't know if it's incorporated, but I know there are some standards for mapping family history. I don't know if that's actually part of OMOP. But and then there are some that are very specifics in terms of prioritizing, or they're not so widely used. That will help us also to prioritize. Because there might be some components in Connect that are very widely used and some that are not. So we want to prioritize that, not Connect as a whole, as an example. Yeah.
I will correct the spelling in this at some point, but I'm just going to do it so I don't lose the information. Okay. All right. Yeah, I like that. It's necessary, needed information. This is also really helpful because I feel like as we're going through the objectives, we're actually also starting to flesh out the outline for the proposal. So this has been really helpful in addition to getting our OKRs laid out for the community. All right, anything else before we move on to objective 3? All right, so the next objective is basically to make sure we're sharing all of this out. So build and disseminate a reusable community resources and implementation tools. And so we want to put these out there to help move the community from project-specific mapping solos towards shared accessible resources. So we've already tried to start creating the wiki as a centralized resource for the repository. One of the things I'd really like to see come of some of the work that's being done is, and as we work through maybe our use cases, we can provide these, but sharing out the ETL scripts. So these are basically the codes that are used to transform from not OMOP to OMOP. The tables used for mapping, that again, our methodologies from these implementations. Again, this is just 5 organizations, could be work groups, institutions. I don't know, again, that there's a minimum number we need to have that's sort of arbitrary, but basically that we establish this and get some examples in there. Any questions or comments on the repository?
Great idea. Really, very important. It's a pain to document, but it's really critical.
It's super critical. And I do think that's a challenge because, even going through this process of trying to do the landscape assessment and talking to people and stuff, we know people have done that. There's scripts that exist. They map things and publish them, but they're all over the place, and trying to get them together sort of like herding cats. But if we start doing things, per the guideline, then those are examples that we can put into the repository. All right, so the next one is, I'll put instrument mapping best practices guideline. So basically the fact that this document that we're creating, we're going to share. So I'm going to change that to instrument. So we're going to, and by publish, I don't necessarily, I know we're working on a paper. I don't necessarily mean in a peer-reviewed manuscript, basically having available to the community this document that we're creating. And it'll include the things we've talked about above. I might actually move some of this up, like handling negation. We know we're going to have to deal with some copyright proprietary information. How does that affect this? And again, I think recommended approaches for, we know the different type of instruments that we have, or these domains or content areas. Why do I keep wanting to say A? There we go. So any comments on that? Maybe we all got worn out, or these are
No.
just simpler because it's documentation.
I was gonna say, Nicole, just being the OCD person that I am, I almost feel like putting these bullets in order. So it would be the instrument mapping best practice guide would be about how do they get their instrument in, right? So I almost would be tempted to put that first because, that's sort of a first thing. And then I sort of feel like this centralized resource repository, that's kind of like, okay, so after you have your data in OMOP, right? After you've OMOPed all of this, here's some ideas for creating the ETLs, right? From bringing it from your source data into OMOP tables. And then is the tool assessment and development piece, is about analyzing the data, or is this, tell me what these tools are for.
So I think it's just looking at tools that can help with this process. So like in our group, we have a tool called EpiHarmony that uses a different algorithm for matching between, well, any two surveys, but for us, it would be the source survey and our OMOP concepts. But like, what are the other tools out there? Can they be helpful for this? Can we share information on it? What are some of the gaps? So like Renska's group is going to be looking at tools that might be needed to fill in gaps with the types of analytics that we want to do with the surveys. So things like that. So I do feel like, again, this could be rephrased maybe, but I think the idea is that part of what we want to document is what tools are out there, how they can be used for surveys, and kind of expand as we learn.
And when you, for
bye, Diane.
Okay, and so are the tools for analyzing the data that's already been OMOPed, or are the tools for actually OMOPing the source data?
They can be both.
Okay.
Yeah, what you have there, it looks more mapping than analysis, but yeah, maybe at some point it could be maybe tools for federated analysis after it has been harmonized. But those, the one you put, are mainly, I think, OMOPing. But actually, there is already OMOPing tools in OMOP, right, or in Odyssey, right? Is that whatever the rabbits and all of these that have?
There are a lot of tools. It's just one.
No, but they're actually Odyssey ones, right? Is that the rabbit in the hat? And so I forgot what it was.
Yeah, there are a bunch of tools for setting up your ETL. And
should that be in the same repository of these tools rather than us creating one? Because if I go to a MOP because some of them do the same thing as EpiHarmony, for instance, but they use different methods. So if I'm a consumer, I would want to have them all in one place if I go to Odyssey. So it's just a question of where to put them, whether we're going to have our own set or whether Odyssey or a MOP, I don't know, have already a repository of tools. And
they do have adding a repository of tools. There's sort of both. So if you go to the main OMOP homepage, there's like a tool section and you can go through a list of the main tools. There are also ancillary tools that are out there that are not necessarily part of that list, but that would be under the Odyssey organization within GitHub. I think once we know if there are things we would like to have to supplement that's already part of the main tool set, then we would have a discussion as to whether it's broadly applicable enough to be included in that main tool list, or if it's just something that's kept under the wiki.
Yeah, that sounds good.
Yeah.
Thank you.
So, all right, we have down to our last couple of minutes. Again, Alice feedback has been really helpful, not just for the objectives, but I also think it's going to help us flesh out the outline more for the proposal itself. Any last comments before we hop off?
Quick request. I never find the GitHub and the places where you have all these recordings. Could you just maybe put it, because I was looking in this chat, if you could just put the link there so we have a place to find it.
Michelle, would you mind popping the wiki link in the chat?
The wiki, and then there was a GitHub page to
Yeah,
that?
so basically our wiki is under the GitHub. Right now, all we've got in our GitHub is the
The wiki.
documentation for the meetings because we haven't really developed anything
Okay,
yet.
great. So if you
Yeah.
get that I can get from here, from there.
Yeah.
Okay,
And then,
perfect.
but
That's exactly what I
eventually
needed.
we'd ideally have, our, code for our tools in there or
Yeah,
our
yeah, that's
ETLs
perfect.
or things like that.
I don't know why I can never find that, but I should bookmark it somehow. Okay, thank you.
Yeah, there's quite a network of the OMOC GitHub. So like I have to do the same thing. Like if I didn't go to it all the time, I would have a hard time finding it. So for next steps, I'll take these comments, rework this. I don't know whether we'll have a chance to meet again before I present it. So I will just share this back for further comments and then let you know when it's going to be presented to the community. So yeah, I think that covers it. Anything else before we hop off?
No, thank you.
Thanks,
That was
Nicole. This
great.
looks awesome.
Yeah, I'm
it's
Thank you.
excited. We're getting
Yeah,
traction.
Thank you. No, we're starting to see how it's shaping
Yes.
very well. Thank you very much. Yeah.
Great. Thanks, everybody. We'll see you next
Thank
time. Bye.
Bye.